Good afternoon, everyone, and welcome to our Impact series on protecting your brain. My name is Leslie Nelson Bernier, and I have the privilege of serving as the president of the UNC Health Foundation. And I'm really excited to talk with you all today and introduce our guest speakers. We really wanted to host this talk because the subject matter is so vitally important. We hear so much about keeping our hearts healthy through following a healthy lifestyle and good diet and getting plenty of exercise. But taking care of our brain is just as important. It's the most important organ in our body. I'm sure our speakers will tell you today. So brain health is vital for our overall health. We're so fortunate to have two experts with us today that will be sharing their exciting work on how to protect your brain. Before I introduce them, I just want to encourage you to please put questions that you might have for our panelists today in the chat. There'll be opportunities at the end of this to ask questions as well, but we want this to be an interactive experience with questions and answers. So let me start by introducing our speakers. Dr. Carolyn Quinsey is an assistant professor in the Department of Neurosurgery, and her expertise is really around minimally invasive brain surgery, and so she'll be sharing some thoughts on that. And then Dawn Kernagis. Dawn is our research assistant professor also in the Department of Neurosurgery. And boy, her expertise is also very vast, but she has a particular interest in neuroprotective strategies. And so I'm so excited for you all to hear from them today. And as we get started, Dr. Quinsey, I'll just start with you and ask, how has the last year been for you? And just offer us a couple of insights into what it's like to be a neurosurgeon in the time of COVID.
Thank you. Thanks for having us. It's been an interesting year for everyone. I think because I do global work in Malawi and Mauritania, and I'm a big travel addict in general, I think not traveling has maybe been the biggest change to try and adapt. But on a positive note, it's really made me and forced me to enjoy the state that we're in. So for my own brain health, I've been going to the beach and to the mountains, just oscillating between the two to feel like I'm traveling and stepping outside of my world or my space. So that's been really nice to enjoy what I've been surrounded by. That's so great. So it's been really nice.
Great. And Dr. Kernagis, I'm going to ask you to share your reflections, and then please feel free to go right on into your presentation.
Yeah, fantastic. Yeah, so thank you so much for having us. I have to say the past year for me has been pretty interesting in the sense that I actually moved back here to North Carolina during the pandemic. So that was pretty exciting and an interesting time to move back to the state, which I personally love. I'm from North Carolina originally. I call this home. And I also started my position here at UNC during that time as well. So it's been an interesting year to try to transition into a new job and get adapted to everything with all the restrictions in life. But it's also forced me to slow down, which I think was probably needed for a lot of us. So I think a lot of us are going full force and nonstop. And so kind of stop and smell the roses or just take things in a little bit more. And I think that's been good for my brain health and for a lot of us as far as a reaction to this pandemic. So yeah, it's been a really good year, all in all, considering the circumstances. So I guess I'll just jump into why I'm here at UNC and kind of talk about some of the research that we're doing. And I'm working with Dr. Quinsey on a lot of this research looking at neuroprotective strategies. So looking at ways to protect the brain and the nervous system, and in particular when someone's in a high stress environment. So for example, if you're going in for surgery, or if you are going in for radiation therapy, or different types of medical procedures that might be kind of high stress for your body. But leading up to that, I have this background of research that ties into looking at neuroprotective strategies. And it's kind of an interesting model. So for individuals on the call, you may have heard of different types of research that involve either animals or cells or looking at ways to protect those different things using different strategies. But my model is using humans that are in extreme environments. So we look at healthy humans who are putting themselves voluntarily under high stress and sometimes very unique stressors. But a lot of those stressors tend to translate pretty well to the clinical setting. So I'm going to kind of talk about what some of those stressors are, and then talk a little bit about one of the strategies that we're looking at to protect the brain and the nervous system in a high stress environment that could potentially translate to the clinic. So here I have a picture of a diver, and I think we have a poll set up right now. So I guess my question for the people on the call today is, have you ever been scuba diving or snorkeling? And I'll give you about 20 seconds to answer that question. I'm not sure. Do we have, I think you guys get the results from that side. Yep, there we go. Okay. Oh, it's about half. Well, yeah, it's about half and half. Okay, fantastic. So for those of you who have been or haven't, I'm sure you've seen, if you haven't been, you've probably seen movies of people scuba diving or snorkeling. So scuba diving itself has some pretty interesting stresses on the body. So I'm going to give you some examples. So one is just being underwater alone, especially for a long period of time. So not typical of what a recreational scuba diver would do, but this is more like military diving, for example. Being underwater for a long period of time can have big impacts on the nervous system. And so we want to look at ways to protect against that. Another thing is nitrogen narcosis. So this is what's called, the divers call it Martini's law, essentially. So as you go deeper in the water, it's like you drink one more martini as you go deeper and deeper. And there's a narcotic effect of the gases that you breathe, in particular the nitrogen that you breathe. And actually that ties into anesthesia and what happens to the brain during anesthesia. So looking at ways to protect against that are really important. Oxygen toxicity. So this is breathing really high pressure oxygen for a long period of time can actually have a negative impact on the brain too. And again, in the clinical setting, there are different scenarios where individuals might be breathing high pressure oxygen or more oxygen than normal for a long period of time. So looking at ways to protect against that. And then also carbon dioxide retention. So when we exhale carbon dioxide, but in some settings, you have a buildup of that gas, which is not necessarily great for the brain, and it changes how the blood flows in our brain and other aspects of our brain and how it functions. And so looking at ways to protect against that. So moving from diving, so that's one population that we study. So moving from diving to altitude, and if you want to switch the screen, yep. So these are Blue Angel pilots. These are kind of extreme altitude performers. And so my question here is going to be individuals asking if you all have had any experience going to altitude or in a mountainous setting. So I think we have a poll here for you again.
I think you just convinced me not to scuba dive.
All the negative things that can happen. I'm going to stick with snorkeling.
Yeah, I'll stick with snorkeling.
Stay at the surface. It's a lot better. Actually, yeah, everything happens deep. So
then we're good.
Okay, so do we have an answer for that one? Okay, great. So it's still close to half and half. So for those of you who have been to the mountains of North Carolina, you may not have experienced this, but definitely if you've been to the mountains, for example, out west, where you get to higher and higher altitudes, the biggest consideration that we look at for individuals who are at altitude is what's called hypoxia. So you're breathing low levels of oxygen. And that can have an impact on the brain and the brain health, and it can also have an impact on how clearly you think and how well and how efficiently your brain processes information. So we study pilots, for example, and we study individuals who work at a high altitude to see if we can find ways to help protect them against those deficits that are related to hypoxia. So my last one, so we're going from sea to altitude, and now we're going to go to outer space. And I don't think I had a question for this one. I don't think I
probably.
Oh, I did. Oh, wait. Have you ever seen a NASA launch in person? Yes, we did have one.
I was sorry. The question was going to be like, have you ever been to outer space? Probably no. Maybe a more interesting question. Would you go?
Would you go? Yeah. Okay. So, pretty cool opportunity to watch humans being launched off the planet if you ever get the opportunity.
You just saw one, right?
So yeah, I actually just got to see one. So it's a colleague of mine who just launched a few weeks ago. She launched up to the space station for 6 months, Megan MacArthur, and she's absolutely fantastic. And her husband, Bob Behnken, is actually he was the first pilot for the SpaceX flight last year. So really exciting times as we're doing more launches from American soil. So things that can happen in space, there's still so much we're learning about how the brain and the nervous system responds to space, especially for longer duration space flight. We're doing more and more of these long duration missions with astronauts, so out to 6 months on space station. And things that we know can impact the brain and the nervous system are radiation. So again, clinical ties there with radiation exposure and what happens in both the short term and long term in response to that. Sleep deprivation, which I think everybody on this call could probably relate to at some point or another, but the astronauts tend to not get as much sleep, and their sleep isn't as high quality over the course of their mission. And so that has big impacts on the brain and brain health over time. And then last but not least, kind of the big one that we look at with respect to astronauts is microgravity. And so this may not seem to really make sense, but microgravity, so in the setting of gravity where we are on Earth right now, you have a setting where you have lower pressure, all your fluids are kind forced down towards your feet. In space, those fluids go to the point where they're dispersed equally. So essentially all the fluids out of your feet shift and they're dispersed equally. So now you have fluids up towards your head that you don't typically have here on Earth. The body's not used to having that kind of fluid shift and having all those fluids up towards your head and in the chest area. So specifically, obviously, the brain being in the head, that's probably not such a great thing. And so we're learning how microgravity and this headward fluid shift impact the brain and the nervous system. So you see here right now, there's an astronaut who's testing his eyesight, and they're doing a lot of different eye measurements in space, because they're learning that with longer duration flight, there are actually pretty significant changes to the eyes and the structure of the eyes, and also the structure of the brain. And what's interesting is a lot of those changes in structure relate to some clinical conditions that we see here on Earth. So we think there are a lot of lessons that can be learned across all those different settings. So next slide. I'm just going to talk about one way that we're looking at to potentially protect the brain and the nervous system in these high stress settings. And if you've ever heard of the ketogenic diet, it's been all the rage. It's been all across media, people talking about, weight loss or how great they feel on the ketogenic diet. And the ketogenic diet, long story short, essentially puts your body into what's called ketosis. And that's a state where your body burns fat to create fuel bodies called ketones. Those ketones are used instead of sugar, which is typically what the body would be burning for fuel. And so if you're on a ketogenic diet, or if you're fasting for long periods of time, so not eating for a long period of time, your body can produce those ketones and you get into the state of ketosis. You can also drink ketones. So there are lots of different types of ketones that you can drink that your body can use as a fuel source. So for example, ketone salts, coconut oil is one. It has a little bit lower amounts of ketones in them, but still something that your body can tap into. It burns that fat into the ketones, into a fuel that your body can use. But there are also something called ketone esters, and these are kind of high impact ketone drinks that give you a lot of ketones for your body to use as a fuel source. And why we're interested in looking at this is ketones actually have some neuroprotective qualities. So essentially when your body burns them, in particular, when your brain burns those ketones as fuel, it leads to reduced inflammation and a lot of different things that can be really, really good for the brain in the short-term and long-term setting. Still a lot of information out there that we're trying to figure out, a lot of things that we're learning through the research that's being conducted, but we're really, really excited about looking at this as a potential nutritional strategy for neuroprotection and a way to protect the brain and the nervous system in these high stress settings. And then also, Dr. Quinsey and I have studies that are leading into looking at ketone esters in particular for neuroprotection in different clinical settings as well. And I'll let her talk a little bit about that.
Perfect. Cool. You can go to the next slide. So just in the theme of talking about extreme environments, this is a picture of an operating room, which is another extreme environment for your brain. Having a surgery is a really traumatic experience for your body and for your brain, in particular if you're going to expose the brain. Interestingly, when we do a second operation, let's say a patient has a brain tumor, their ability to tolerate that surgery is improved in the second surgery. There's something about the fact that the brain had been exposed before and sort of almost like a learned tolerance, which is sort of interesting. But the operating room is an extreme environment for your body and for your brain. And so that's where Dr. Kernagis and I are working together to figure out how do we minimize the impact of this trauma so that your recovery can be as good as it can be and that your brain is performing at a high level. One patient population that we're interested in particular is we noticed that patients who are having tumor surgery, like pituitary patients in particular, there's something about this patient population in which their energy levels drop significantly. And there's something about this surgery that really impacts their body. And there's other patient populations too that have this sort of major effect on their brain and their body, like a fogginess that your brain feels while you're recovering, that sort of thing that we're trying to target to figure out, if we were to give these ketone supplements to this patient population, would it be possible to amplify their recovery and make that a shorter period of time? You can go to the next slide. Let's sort of zoom in. There's a picture of a head CT, which is a scan of the brain. And then there's a blood pattern, the bright stuff on the left side of the screen there. And so, a traumatic brain injury, trauma to the head, definitely, these are of course an insult directly to the brain. Blood in particular is really irritating to the brain. And so if anybody has ever had any sort of, if you have surgery, it's normal to have a little bit of blood product in there, or if you were to be in a car crash or an injury or something like that, and there's blood will irritate the brain and cause headaches, usually for weeks. Our body breaks it down and then readjusts to that. But having any of these traumatic injuries to the brain, that's the initial insult. But we're interested in trying to figure out how do we then minimize the effects of what happens after. So if you have a brain injury and then there's swelling while you're hospitalized, can we reduce the swelling? Are there ways that we can sort of get through this initial period? And then also, as you're recovering, say, from like a concussion, that's a study that we're going to start in the next couple months. If we give the ketone esters to a patient population who just had a concussion, could we reduce their recovery, or could we prevent the kids or young adults who have prolonged symptoms, like beyond a month or something like that? So that's one study that we're going to do soon that we're hopeful will help to reduce the brain injury period. You can go to the next slide. And then another exciting area that we're interested in, we're going to be working on soon, is in radiation. And so radiation is really useful in helping control tumors and their spread and disease, but it is sort of a direct insult to your brain. And we do use really innovative radiation techniques. Ours it's called CyberKnife, and it gives really focused radiation. And even if we're not using CyberKnife, we're using more conventional radiation, our physicists will plan it with us in such a way that we really reduce how much radiation your brain is getting in other areas of it. But the fact is that it is giving you some radiation to the normal parts of your brain, and that definitely can impact both brain function as well as energy and things like that. And so this is another really great way to target an actual, it's very controlled. We know when you're getting radiation, and we know when it's going to have an insult to the brain. So again, we'll be using ketone esters to see if we can reduce the effects to the normal parts of the brain and speed along the recovery for these patients. And then, as Dr. Kernagis had mentioned, this has direct implications sort of for the reverse. Usually you use things like, we're saying extreme environments, deep diving in space to learn something about patients, but I think patient radiation will help us make astronauts safer as well, to figure out how to protect our brains in radiation exposures such as like in space, that sort of thing. So you can go forward. I think that's our last slide of prepared talk. Yeah, perfect. Good. So I think that's all we have prepared, and we would.
Well, thank you, ladies. I'm so honored to work with these two really masters of their craft, I would say, and we're just so grateful for all the information. But we've had quite a few questions pop in, so if you don't mind, maybe I could read some off and you all tackle them one by one.
Of course. Perfect.
Perfect. And just so you all know, I'm Erin Johnson. I'm the Director of Development for Neurosciences here at UNC Health and the UNC Health Foundation. And we're so grateful that all of you are here with us today. So one question was, what is the impact of hyperbaric oxygen chambers?
So yeah, I can take this one. So obviously hyperbaric oxygen chambers. So these are high pressure chambers that allow you to deliver oxygen at a very, very high pressure. So typically, clinically, oxygen can be delivered up to 100% to patients. But if you put them in a hyperbaric chamber, you're breathing 100% also under pressure. So you're getting even more oxygen to that patient. So hyperbaric chambers can be super useful for a variety of indications that I could go through. That's a whole talk in and of itself. But as far as the impact of them in some of the settings that we're talking about, so I talked about the high pressure oxygen, the oxygen toxicity in divers. That's specifically you're breathing high pressure oxygen for a long period of time. So the hyperbaric oxygen chambers have been kind of tested out over a long period of time to identify the periods of time that patients can be treated under pressure without putting them at risk of oxygen toxicity, or at least minimizing the risk of them developing oxygen toxicity. So ideally, hyperbaric oxygen therapy is supposed to be beneficial and should be beneficial for patients and not putting them at risk for oxygen toxicity.
Wow. Thank you. Another question that came in was, there seems to be a high incidence of suicide in astronauts, including former UNC physician Chuck Brady. Do you have any thoughts on this?
Of astronauts? that what the question was?
In astronauts, correct.
I am not familiar with that data. I'm not familiar with this data actually. So I have been told that there's some indications that individuals, after they've gone and done something extreme like onto space, that there could be some psychological adaptation, issues coming back. But this is, just hearsay, not just hearsay, but it's been talked about in some of the panels that I've been involved with. But I don't know anything more specific than that.
Well,
interesting question though, so I'll have to
very
dig
interesting question.
Yeah.
Now we're going to go do some research, it seems. I do have a couple more if you don't mind. One was, what are the effects of radiation on patients' brains? I think, Carolyn, you touched on this a little bit, but is there anything else to add to that question?
Yeah, definitely. Radiation is a really effective and important tool that we use when we're controlling cancer, or we actually use radiation sometimes to treat vascular lesions or other issues. And so it's a really great tool to use. And like I mentioned, we work really hard to reduce the amount of radiation that the rest of your brain is getting. And so it can be changed so that the beams that we're creating to give you the radiation dose will spare particular parts of your brain in particular. So like the hippocampus, which is so important for memory, we'll make sure that none of the beams are going to cross through that area in particular. And the eye nerves are really sensitive, and so we work around that. And so the radiation is sort of set up to give a max dose to treat what we want to treat and minimize to the whole brain, but to extra minimize the really important, crucial parts of your brain that we need. But still, you are getting a dose of radiation to normal parts of your brain. And so there's an inflammatory reaction that happens right during and after radiation. And then also there is cellular damage that at a low dose, you should be able to repair and see minimal long-term effects. So those would be the basic things that happen during the radiation.
Well, I think that's on a lot of people's minds, so thank you. One question would be, could astronauts benefit from clinical research or vice versa?
Yeah, absolutely. So we've kind of alluded to that in the talk, but both the looking at radiation exposure and what we learn with patients undergoing radiation therapy, and looking at neuroprotective strategies for those individuals, that's one place where we could definitely see potential benefit. And the other is these clinical populations I was talking about. So for example, normal pressure hydrocephalus is a clinical condition that somewhat mimics what we see in the astronauts and what happens to their brains and to their eyes in space. Somewhat, there's not an exact match, but it's close. And so we think that if we can find ways to treat those patients and also to identify ways to kind of track those patients' conditions, maybe that can translate to the astronaut population as well. So great question.
Great.
Yeah, also, I don't know if you want to mention the research about fluids, lymphatics, that sort of thing. There's actually, probably a lot of people don't know, there's a lot of research on astronauts that helps us inform us about in medicine, and then there's a lot of clinical trials that are meant to help astronauts. So I think the TILT one in particular, if you want to just mention that one, is super cool.
Yeah, so one of the ways that we try to simulate what happens in space here on the ground is really hard, right? So I talked about that fluid shift that happens, and there's no exact way to replicate it, but one way that we can replicate that here on the ground is what's called head down tilt. And so essentially we put healthy humans, they get paid a lot to do this research, by the way. So we have healthy humans that are in -6 degree. So this would be flat, so they're -6 degree head down tilt, and anywhere from 30 to 60 days typically for the studies that we do. So strict head down tilt, they don't move from that position, because in microgravity you don't get relief. So in space you don't get relief from that fluid shift. So these participants don't either. Again, they get paid a lot. So this is all voluntary, and ethics review has reviewed it. But we've learned a lot about what happens when you have that fluid shift, what does happen to the brain and the eyes, and how the body responds, which is really, really interesting. And like Carolyn was saying, there's a lot that can translate to the astronaut population for that, but also things that could potentially translate over to these clinical populations that we're working with.
Yeah, similarly, the eye syndromes, the vision loss that they found in astronauts really helped us understand different kinds of adult hydrocephalus differently, because they're idiopathic, meaning we don't know how they work, but knowing that there's something about the gravity space in space that made us really understand, oh, it's probably a fluid dynamic problem. It really helped us as doctors sort of understand it a little bit better and guide future research. Yeah.
That I'm having a hard time getting my head around the head tilt, but yes, all really good information. Another question that came up, these are questions that were pre-submitted, were what specific foods or nutrition-based items are good for the brain? Do you have any suggestions?
Yeah, that's a great question. I would love to tell you that there's like one amazing food or supplement that's going to like protect you and make everything greater, because I would love it. I would take it if that was the case. But you know, the reality is what you might expect, that that having all of the nutrients that you need, and so you know, a lot of diets target like one specific thing, but the reality is our bodies are really complex and you need a lot of different things for it to function properly, as well as if you're, let's say you're going to have radiation therapy, you're going to have brain surgery, you know, doing something right before a surgery is probably going to have minimal to no impact. But if you improve your diet to make sure that you're getting all the nutrients that you need, and then also optimizing your sleep in particular, those set you up for a way better success and health than to take like a specific supplement or vitamin or whatever it might be. It's probably, especially in the short term, is going to have a really minimal effect. And so yeah, I wish it was that if we could just all eat avocados all the time, and then we would be like super crazy healthy and smart. But you have to have more than just one thing.
Sure. I think there's a lot of companies that would probably tell us otherwise. So I appreciate some grounding there. Some grounding.
I wish it was the other way around. We could take a super supplement.
Right. Absolutely. Speaking of food, you mentioned ketones. What other ways are you studying to protect the brain? Are there other things that are coming up?
Yeah, so one of my other big areas of research is looking at the brain lymphatic system. So it's just about 10 years ago that it was discovered that we actually have a lymphatic system in our brain. So we know that there's one in the rest of our body that plays a lot of different roles with immune function and kind of clearing out waste from the body. But it turns out the brain actually has its own lymphatic system too, which is really, really cool. To think that we just discovered that is pretty insane in and of itself. So, so we're doing studies right now looking at the brain lymphatic system, particularly, it's just to tell you how it works. When you're in deep sleep, your brain kind of goes through this kind of washing machine motion, essentially exchanges like fluids and gets all the junk out. And then that junk kind of flushes out to the rest of the lymphatic system in the body. So this is when you're getting deep sleep. So if you think about when you don't get deep sleep, how you feel kind of foggy headed, don't feel like great the next day, especially if you have cumulative nights like that. This is why we think this is why that plays a role, and why sleep plays a role in how good you feel with respect to brain health. So we're learning that if you have a dysfunctional brain lymphatic system, if it's not working optimally, you have accumulation of that metabolic waste, of that junk in the brain that normally would flush out at night. And over time, especially long term, that could set you up for things like neurodegenerative diseases. So definitely something that we want to work optimally. And so one of the things we think is that the brain lymphatic system could be a system that we could tap into to optimize brain health even before a high stress exposure. So for example, before you go into surgery, is there a way that we could optimize the brain lymphatic clearance to get all that junk, make sure it's all cleared out before you go in for a surgical procedure? Or these different extreme environments, same thing. We're looking at the brain lymphatic system right now. We have a couple of funded studies from both the military and also NASA looking at how does the brain lymphatic system work in extreme environments, and then can we get it working optimally as it is impacted in those extreme environments? So something we're really excited about and look forward to future research.
Yeah, another one, what's so great about having a PhD in our department is that, you know, when we're talking about scenarios and like ideas and just bouncing things off each other, we're talking about hydrocephalus cases, and Dr. Kernagis, you know, was observing one of the surgeries I do. One of the things I do is I reduce the amount of air that's left in there. And then we just got to chatting about it, like why remove it? Is that significant? And we think it might be irritative. It's not meant to be there. And so that's another area of research, is looking at, do procedures that introduce air inside your brain, do they have a irritative effect? Does reducing the amount of air that's left there in a surgery, could we improve outcomes? So one other area.
And there's a tie that back into diving too, because divers can get air bubbles that pass into the brain. So again, kind of crossing over from clinical to extreme environment and back. So
yeah,
it's amazing. We're so lucky to have both of you as part of this. And what a team. And I feel like UNC and our patient population are really, really lucky to have both brains be working on this. Another question would be, are there any dangers to neuroprotective measures?
One thing I would say, you know, there's a lot of really great science going around, like ketogenic diet for cancer in particular, and all really positive. I think that if you make an extreme change like a ketogenic diet, or you make some sort of extreme change, that can be really traumatic and stressful in your body. So it's probably not a good idea to make major changes in your diet or something like that right before having a surgery or radiation or something like that. That I think that if you wanted to make a major healthy lifestyle change of any sort, that you would want to do so in like a thoughtful way and to not go to extremes. And I think too that that when you're thinking about supplements or changes in environment, we're always considering, could there be a negative effect? And what we know about ketone esters, the most negative effect is that they taste bad. But because our brain loves ketones, none of the animal science tells us that. And it's always possible that we could find that there could be a negative effect to that. But it's something we're really mindful of, that we always want to make sure that we're adding a positive and not a negative. The other one I would say is when thinking about hyperbaric or something like that, like that in the acute phase of like a brain injury, it's possible that things like hyperbaric or something like that could have more oxygen toxicity. So it's definitely a great consideration to make sure, are we optimizing both the strategy, but the timing of that, so that we're really supporting the brain.
Which is why the research is so critically important.
Yeah.
So.
Absolutely. That's amazing. We just had a question come in live also. What drugs should you avoid that might affect brain health? Do you have any suggestions?
Well, I think in general, don't do drugs.
I guess we don't know. Drugs or pharmacological drugs? Yeah.
I think probably you're not alluding to street drugs. I think that any of the drugs that have primarily brain impacts that aren't necessary. So, I think that there are certain medicines that target the brain that are really important to optimize your health. Those may or may not have like a negative effect, but if they're important for your overall health, those are really important. But I think sedating medicines, when they're used for a particular reason, are really important, but they could over time have like negative effects on the brain. So the more targeted it is to the brain, the more likely you could have long-term effects from that.
Right. When you think about it, it makes a lot of sense. This is more clinical, but is each concussion the same, and does recovery look the same for each person? How does that fit
That's a great question. Yeah. Concussions are like snowflakes. They're never the same. Even in one person, it's going to be different every time. And from person to person, it's going to be really different. And the one thing that we know is that, let's say I have one concussion, the threshold for me to get another concussion has just lowered. And so it takes a lot less force for me to get another concussion, as well as my symptoms will definitely last longer. And then you stack a third one, the threshold's even lower, and my symptoms will be longer. And so the more times you have a concussive injury, the more likely you are to have long-term effects. And some of them can be permanent effects after, sequential stacked concussions. So when I'm advising families with kids who are playing like high-risk sports, it's always a balance of, if a child has 3 major concussive injuries, took months to recover from the last one, it's really difficult, because being a part of a sport is really important for, who we are. Being a part of a team is so healthy. Engaging in activities like that is so healthy, but our brains are precious. And so it's always a really difficult conversation of balancing those two things of, if your identity is that I'm a football player and all my friend group is there and those friends are good people, and it's super important to do that, but also protecting your brain is super tricky too. So those are always really tough conversations of, these high performing athletes that really want to stay in their sport and they love it and it's a part of who they are, but we also really have to fight hard to protect their brain.
Absolutely. It's precious cargo. What other research? I know you've touched on a bunch. Is there any other research you're working on right now that maybe we haven't been able to cover?
Yes, I talked about the brain lymphatic work. So I've got a fair number of grants that are focused on that actually. So we're looking at the impact of low oxygen. So I talked about hypoxia. We're looking at effect of high CO2. So I talked about that, how all those things impact brain lymphatics. We're also looking at that head down tilt is not 30 or 60 days. It's a very short-term period. So just for like, a couple of hours, but we're looking at head down tilt and seeing if you get that little bit of fluid shift, if that impacts the brain lymphatics. So we're pretty excited about that. Also part of a study where we're following astronauts. We're doing brain imaging of astronauts pre-flight and then also following them out post-flight. So we're looking at up to 5 years after they complete a mission, so one, we know that there are changes that occur in the brain and the eyes. And so we're trying to see, does that resolve over time? Because right now they've only followed them out to 6 months. So super excited about that study too. And then one other brain lymphatic study that I have going is looking at marine mammals. So totally different space, but we're actually, the Navy, who has a big marine mammal program, is really interested in protecting the brains of their marine mammals. And so they want to know, hey, do they have a brain lymphatic system that we should be paying attention to? So we just got funding from the Navy, and we're working with a group on campus at UNC to look to see if marine mammals, so dolphins and also other diving marine mammals, have a brain lymphatic system. So we're pretty excited about that.
And then we're working on a funding proposal to hopefully in the next year or two be able to look at negative pressure, lower body devices. So to create, more of a gravity-like experience to change the lymphatic flow too, in the same sort of patient population that you were just talking about.
Yep.
And then I have clinical research looking at surgical outcomes, preventing seizures, and improving surgical outcomes too.
That's fascinating. Two more, I think. What can brain surgery patients expect post-surgery? We've alluded to this, so I'm sure it's different for everyone, but
yeah. Well, and there's so many different procedures that we do, and so they can be variable. I think in general, if your body has any surgery, it will take a toll on just sort of like your energy, because your body has to recover from something. And so just expect that, all of us perform here. This is day to day, and I'm able to be creative and be, a social person and that sort of thing. When your body is putting all this energy into repairing or recovering from a major event, a lot of times people will notice that like they're just a little grouchier, they're a little less patient, that we're just sort of not at our best, because those things take like that high level, working at your highest level. And so I think the hardest part for my patients who are really high performing is like that they're really impatient about that. They're really frustrated with themselves. It's really hard to be patient with yourself, because you're used to being, working at this super high level, and to, look at a couple week recovery of just not performing at that super high level, and you being like, this should be faster, like I should be feeling better. And you just have to give your body, the time that it needs to heal. And I think when it comes to brain surgery, that's just more profound, because not only is your body diverting energy elsewhere, but we did something to your brain, and so your brain itself has to recover. So there's like a fogginess that you feel, or just a general fatigue, or just not feeling like you're performing at your top level, that I think it can be difficult. And I relate to that. I think that if I was having a major surgery, that I would the next day after be like, why am I not better? I should be better by now. It's just hard to be patient with yourself, I think.
I think that's a good life lesson. We all have to be a little bit more patient, period. Two just came in that are live. Is it true that anesthesia worsens symptoms and brain function of dementia illnesses?
I don't know about dementia specifically. Anesthesia in small doses for like an operation that's not lasting many hours, we know to be very safe, especially if you look at a child who's less than 3 months, then we really think about, in such a rapidly developing brain, could anesthesia have negative effects? So we're very cautious about using anesthetics in young babies, and then also the length of it. So we know in, like, say, big surgeries like open heart surgery in a child less than 3 months, because their brain is developing, we're more suspicious that they could have negative effects. Anesthesia in the doses that we use for most surgeries in a non-developing brain, we know to be pretty safe, and in some cases actually neuroprotective. There are some agents that actually help protect your brain to the stress of surgery too. So we're constantly trying to make sure that we're optimizing, making sure each anesthesiologist, there's a cardiac anesthesiologist and there's a brain anesthesiologist. So the brain anesthesiologist is thinking about which of these agents is going to be good for the brain, and then is going to like not increase the pressure of it, and that sort of thing. So these are all considerations when the doctors are thinking about what's going to be the right agents for this patient like specifically. I think if you look at like high doses of and like long use of any sedating medicine, like I said, it targets the brain. Anything in extremes is going to have negative effects, but having a surgery with anesthetics is a safe thing to do.
Yeah, well, we appreciate everyone's work on that. And one more came in live. It seems that ketoacidosis has a negative effect on the brain, like diabetic. Is it due to the amount, type, or pH? Do we have any idea?
So ketoacidosis, yeah, and also it's an extreme of ketosis. So talk about going into ketosis where your body is kind of optimally using this fuel source. Ketoacidosis is kind of this extreme version of that. So the things that we're testing right now, so those ketone esters I was talking about, if they're consumed in the doses that they're supposed to be consumed in, are very, very safe and don't put you into ketoacidosis. So just that's always kind of a misconception. People like, oh, ketoacidosis. There is a healthy and safe point that your body's actually supposed to tap into. We think it's kind of an evolutionarily protective mechanism that your body, if it doesn't have enough glucose to use as fuel, can tap into and create these ketones as a fuel source over a period of time, or your body can consume ketones as a fuel source in a very safe way as long as those levels are within a certain range. So
yeah, I think of ketoacidosis as like a crisis.
It's a crisis.
Yeah, which is different than having available ketones by ketone esters or the ketogenic diet, which also makes ketones available because you're metabolically flexible.
Sure. Well, it seems like anything extreme is probably something we avoid.
Yeah.
In life. So, especially for the brain, that makes sense. Well, I think we've wrapped up all of the questions. These were incredible ones. I've learned a bunch as well. So I hope this has been helpful to all of our guests today, and of course to our panelists, Dr. Quinsey and Dr. Kernagis. I wanted to just reintroduce myself as Erin Johnson. I'm someone you can reach out to if you have questions, if you want further information about what they're doing and the research our Department of Neurosurgery is doing, and either of these incredible doctors. So I can put you in touch with them. I'm happy to have coffee with you as well. So please reach out if you have any questions. And also, if you want to follow them and see what they're doing live, you can always follow them on Twitter and on their social media handles. And we have listed them here. And if you do forget to write them down or you can't find them, please just reach out to me. And then also, if you ever have interest in supporting their research, private philanthropy is what makes them be able to do what they do and to move the needle into the work that will eventually cure a lot of things that we can't cure right now and help our patients so much. So private philanthropy is needed and appreciated, and we're happy to help you find a way to do just that. So we have a neurosurgery education fund that supports these two physicians and PhDs, and it's just we're very grateful for all that support. So again, reach out if you have any questions, and you're going to receive a survey after this call when we hang up. Please feel free to fill it out. Be honest with your feedback. We'd love to hear from you. And also, please mention what you'd like to learn about in the future from the Health Foundation. So we have, of course, a breadth of information that we can share, but we don't want to overwhelm people. But we would love to see what interests you and how we can move forward from there. So thank you again for joining. It's been a true honor to be with you all today. Dr. Kernagis and Dr. Quinsey, thank you so much for your time today. It's a true pleasure, and I'm honored to work with you every single day.
Thanks so much.
Thank you.
Bye, everyone.